I'm Dr. Anthony Maloof of Eyes and Faces and Cornea and Oculoplastic Surgery in Sydney, and welcome to this video on CAIRS and ICRS. So what do all these acronyms mean? We love acronyms in medicine. Basically, what it is a way of changing the shape of the cornea in keratoconus, the distorted shape, and trying to make it more regular to improve vision. All great stuff. That's exactly what we try and do. So let's have a look at what it does. Firstly, this is a model of the eye. And what you see here is the eye, and the cornea is at the front. The cornea is a round lens. So when you look at the side, it's round. In keratoconus, it is distorted. And you can see this distortion, and it comes to a point like a cone. Cone, front of the eye. The whole point is, how can we turn that little distortion into a round shape? And one approach is called CAIRS or ICRS. ICRS involves putting rigid rings into the cornea to try and squeeze it into shape. CAIRS involves using donor corneal tissue, which you try and squeeze it into shape. Let's give an example of what happens. The cornea is an elastic tissue, so when I operate on it, it's very elastic. So here's a sponge, very elastic, I can bend, and literally that's what happens. The problem is that elasticity varies between people, between their eyes, and all around the cornea. So imagine I get this sponge and I put a rigid rod, take this beautiful rock here, onto it. The sponge will deform around the rock. And that is where our problems lie with this approach. We can't map or predict how it will deform. Plus, nature has an adaptive function. You put pressure on a tissue, it will then model around that pressure. That's how orthodontics works. You put a band on the teeth, move it, the jaw remodels, and suddenly you get a better sitting teeth and a better jawline. That is the problem we face when we put rigid structures into an elastic tissue of the cornea. And that therefore means unpredictability, and that translates to the patient as dissatisfaction. I had surgery, it didn't really do much, or it was good initially, and then it changed. And patients come to me all the time with these ring segments, go, look, it worked for a while, and now I'm back to where I was, can you fix it? And that's the fundamental flaw with this approach. It makes intuitive sense, yeah, put something in and reshape the eye, but long term, it doesn't work. It doesn't work as predicted. So you will see cases where people say, oh, my vision's better, and they say the lines of vision has improved, but that's very soon after, and over time, if you watch them, they change. So it's a surgical approach that I don't use, and I tend to reverse. And I'll explain that in my next video on this topic. I'm Dr. Anthony Maloof for Eyes and Faces and Cornea and Oculoplastic Surgery in Sydney, and thanks for watching.